Yes.
Yes. So thank you, Maya. Actually, when I was given this topic and Dr. Mohita asked me to speak on this, I was not very sure how should I take it and how should I take it forward. And she asked me for a title, and I was very confused. I said, a mentor can only take the mentee forward. That's what I thought, and I said, let's start with the saying that okay, this is the way forward, and this is how we should go about it. So uh, I also one sec. This is a little. I can't move my slide. Can you share, Maya? Can you share the screen for me? I'm sorry. I guess I am having a little problem in. Yeah, next. Yeah. So when we think about mentoring anybody, what does it actually mean? So is it that you just find somebody and you ask them to help you, a kind of a thing in whatever you want to do? No, it's kind of a process. I feel mentoring is a process, and there's a relationship which develops between a mentee and the mentor during the mentoring process, and it involves both transmission of formal and informal kind of a knowledge. It could be just on a personal level, it could be on a professional level, or it could be combined together on a professional and personal level. And why we are talking this today, because was and now wow basically are looking out for mentoring women clinicians or women researchers, because this is where we are lacking. And as Dr. Femida herself, she showed the numbers and the figures, and how much we need this mentoring to bring the women up, and to take up research, to take up jobs, to increase their working hours, to increase their income. Because whatever she showed was definitely is this is what which happens in India, and we are all going through it as a society. Next, please. So it is not that it started here. It started way long back, and mentoring was basically when I was looking at the history, it was just that the when a warrior went into the field, he kind of left his family, particularly the son in charge, to a mentor. So this is how it started, that when you go out and do something, it is somebody who's going to learn the experiences, or learn the nuances, and becomes your teacher, a counselor, a trusted friend. And this is how it starts, and mentoring can start at any age. Next. So for me also to understand mentoring, when I started helping PGs or other clinicians or other researchers, is that it was very, very challenging for me also. So it is not that you become a mentor just because you are on a particular position, you are doing certain kind of a surgery, or you are very good at something else. No, it is not that you are able to mentor. It is very challenging, and it's a personal developmental relationship that you get into it. It has to be very motivating for both the mentor and the mentee, because a lot of times the mentee would get bored and would not feel very inspired, and similarly the mentor can also would not be so motivated, and if the mentee is not according to the wishes of the mentor. And so it has to be both inspiring, motivating, and all this becomes a very challenging process. And this is what we need to understand, that wow is all about mentoring, and it's a difficult process, it's a long road, but it's definitely very, very interesting also. Next. So this mentorship, it developed as a concept. So you kind of manage the relationship, you encourage the other person to to take up whatever they want to, or whatever they are very good at. You nurture the not only the skills, you nurture the feelings, you nurture that relationship, you teach them, because a lot of times you tend to become the teacher, and this comes out of mutual respect. So if you don't have a respect for your mentee and the mentee doesn't have a respect for your mentor, it will be difficult. And also you should be very appreciative of the fact that you should respond to the mentee's need, because you might be very good at something and the mentee might not be so good at that thing. So this is where you should understand what your mentee needs from you and how would you go ahead and mentor. Next. So what makes a good mentor? So we have this program of WOW, and we are looking for very good mentors. So we always tell to people that please do come, please send your names as being a mentor. So does it that you are in a position you become a mentor? No. So it is the first and foremost is the desire to help others succeed and the willingness to pass the information. Because if I'm doing a particular surgery and I do not teach them the tricks and traits of that surgery, there's no point mentoring the person, because I need to tell them the nuances of the surgery. And also when you give something to the mentee, you tend to receive a feedback, which is very important, because the Maya Hada is taking care of the mentor-mentee program of WAS here in India. And when I was making this presentation, I gave a call to her and asking that, how was the feedback? Did you receive any feedbacks from the mentees? And she was really kind enough, which I will be sharing the lot of screenshots, and she was kind enough to share as and what she got out of the mentor-mentee program. Also to desire to work with others. If I am if I am interested only in my selfish gains or in my things only, then I would not be able to become a good mentee. And I need to engage them with each other at an interpersonal level. There's a desire to learn both from the mentor and the mentee, because here, if the mentor is not understanding the need, then that desire should be there. And with a lot of lack of prejudice and a lot of patience is what good mentorship would do. Next. Similarly, so it's somebody you can trust, somebody you feel comfortable. So we in our WAS program, what we do is that we ask them to choose the mentors. The mentee can choose their mentors, because we know each other, we know what they are doing. And if you feel you can share only the good news with your mentor, that person isn't a mentor. It is somebody that you are reporting to. He is your employer. So this is not that only the good news should be passed on to the mentor. It is somebody that you can share, and like I have this problem, I'm struggling to deal with it. Please come up with something, or have you come across something similar? This is how a mentorship would work. Next. Similarly, when we're looking at the mentor-mentee program, we are looking for a mentee who has the willingness to learn about themselves and also to learn about the experiences. I came across a lot of mentees who, when I show some kind of a surgery, they always keep telling me this is not what is done, or this might not be done, or this would have been done better. But then over the period of this, I realized that their experience do count, but when you are a mentor, you need to put your experiences in place, and you should tell them that this is how I learned over the period of these many years doing these many surgeries. So this is a willingness to learn from both the sides, also the commitment. Because if I commit being a mentor, you also have to commit as a mentee. And patience, again, on both the sides is very important, and the respect for people's time and effort. Because if I am taking out time to teach you something, it is again, you need to respect the time of the person who is making an effort, and we should have realistic expectations. So what we do is that when we started with the mentor-mentee program of WAS, we had we actually were not expecting anything. We had very basic and realistic expectations. We focused on the basic needs of the mentees. Next, please. So here is a mutual trust, a regular contact and conversation that we keep in touch. We form WhatsApp groups, and there are certain people from the WAS who keep a track of these groups, and they keep the conversation alive, and we do not dissolve these WhatsApp groups once the mentoring session is over. There's a genuine belief in the process, and we are tending to believe more with the passage of time that this definitely does work, and the desire to build the institution, because it's kind of a mentor-mentee relationship, and it helps both the persons to grow. Next, please. So this, are you looking at a leadership? No. If I am a mentor, I am not looking to be a leader. I am a situational leader. I am helping the person in development of technical skills along with the overall development. So I'm not the leader for that person. I'm just the situational leader. I am helping them in a particular situation to come out or do better in that situation. So it is not something that I'm a leader and you should listen to me, or I'm going to lead you throughout throughout your professional or your personal journey. That is not mentorship. Next, please. So I'll cite an example next, Maya. So I'll cite an example. So this is what we thought of as a mentor-mentee program, and the first time in Jaipur was in 2017. Dr. Mohita and Dr. Rohit Shetty were really keen on having this, and so we developed a model, a conceptual model of finding a great mentor and finding a great mentee. So it was like a matching of mentor to mentee, and this was the first time in India in a conference in WAS that we had this mentor-mentee session, and in one-on-one opportunity to meet with your mentors. So we invited mentors who were good in different areas of their specific fields, and we also gave a call to all the people who could be mentees. So they get to choose the mentees and they choose the mentors too. So this is what we launched for the first time at the WAS second annual conference. Next. So how do we choose that what to do? So Dr. Shweta and Dr. Maya and others, they came up with an idea that we should create a Google Doc, and asking for Sunita Dubey and other people. So we created a Google Doc asking for mentee to choose the mentor. So we had a list of mentors that we released, and we asked them that whomsoever you want to choose, you can choose the first, second, and third preferences of the mentors. So this is how we connected the mentor and mentee together to share and learn. Next. So this is the art of mentoring is skills and attitude. It is not only the skills. So our mentors are very apt in their skills and equally good in their attitude towards the mentees. And again, the mentees are learning about the skills, and also their attitude to learn is what actually made the difference. Next. So I would again say that skills required by the mentor and the skills required by the mentee, it becomes the mentorship skills. So this is how we matched the mentor and the mentee. And next, so these are some of the programs that we came up with. It's like a Happy Independence Day. We again launched this program after the Corona Blues, saying that independence from Corona Blues, and you're not alone in your professional journey. And this is choose your mentor. So this was a flyer that was sent, and with the mentors and where they were placed, what specialty they had, and there was a Google Doc which you could document that you could fill, and you could choose the mentor 1, 2, and 3. And we asked the mentors to have a different sessions according to their own convenience. And then we had this Zoom meetings, a very one-to-one personal meetings that we had, and interaction with these mentors, because it is not possible in conferences and other places. So they chose the mentor. They have like 5 or 6 people in one room, and then they come up and they're more open, because we realized that the mentees were very open, and they actually were, some of them were struggling at very basic levels. So we could tell them how they should go for their fellowships, or how they could find a job, how they could balance their the clinicals and the personal life, or how would they, where they could be recommended for a refractive fellowship outside India. So we had mentors from all specialities and all over the place in India, and we had mentees, and they came up with very basic questions that they had. And it was very important that we, the mentee was responsible and actually was very sensitive to the needs of the mentee, and the mentor was very sensitive also. So this is how we match the mentor-mentee, and these are a couple of the programs that we have in pipeline. And it is not that the mentors were only professors or only senior consultants or very with too many publications. No, we had mentors from all levels. They could be assistant professors, they could be associate and professors, they could be just the starters who did a fellowship, so they could train other people how to get into a fellowship, or there were other people who were doing very well in a government job, so they could tell you how to get a government job or how to start your own practice. So this is how we chose the mentors and match the mentees. Next. So when we look at the overall program, it actually it not only helped the mentee, I feel it helped the mentor in many ways. Like as a mentor, we realized that we could be molded to get into a higher position. So all the time that we are taking and interacting with the mentees is making a positive difference in somebody's life. So you feel, you have an elated feeling, you feel happy, and you have an opportunity to learn from the mentee as well, because you tend to realize this, that maybe that's the problem that you could also face at some point of your time. And there's a constant engagement and encouragement that the mentor feels, but for the mentee also, you learn from the vision and experience. This is very important, that that experience that you could have gained over the years, you are learning as well. There's an opportunity to network. They would connect you to a lot of people. They would benefit from the trusted opinions and advice, because we know that they are giving us a very good advice, and it reduces the isolation for the mentee. A lot of mentees, they told us that we were feeling very left out, we didn't know what to do. So now we feel part of the group, and when we meet in the next conference, I'm so excited to meet you, I'm so excited to work with you, I'm so excited to come to your hospital and see you, what work you do. So that's kind of an encouragement for the mentee as well. Next. So here that we start that you can do this. We always, as a mentor, we tell them you can do this. And when we see that there's a downfall in the mentee, we always tell them don't give up. You're almost there. And sometimes we always see that they tend to reach with time, and they reach their levels, they reach their goals, or at least they're nearer to their goals because of the mentorship. Next, please. So these are some of the feedbacks that they said, that these are WhatsApp shots, and they said it was a great session and thank you very much. I would like to be included. Can you have a 1-2 day training sessions? Next. So it is basically a performance coaching that we do, but the sad fact is that it is difficult to find a great mentor. But it is not always true. But if you don't try, you will never get it. So this is how it works. Always find a good mentor. It is not about the program of mentor-mentee, or not about WAS, or not about WOW. It is just that you should always find a great mentor who could help you. Meet new people, be open, and it's the luck that counts. I always say that if you are destined with a good luck, it is nothing like it. And finding a great mentor, just be the best, but it is more impactful step of your life to find a good mentor. So if this society, WAS or WOW, is able to make a difference in one life also, it makes a lot of difference. And this is how we started as a vision, that we would make a little difference in each and every life, a little difference. We are not promising you something very big. We are not coming out that we are going to do this, we are going to do that, but we are just connecting to people to you. We're just trying to get you out of your cocoon, so that you could just be, find the best mentor, find the best place, find the best environment, or at least get closer to your goals. So this is how I say that we are connecting you to the best people. So come out and join this program. Next, please. So I always owe my mentorship to a lot of people. There are not too many that could come, and I had very little time to prepare for this talk, but I am sure I left out on many that I remembered. But my journey started with my fellowship with Dr. G.N. Rao, and who could be the better person to learn cornea when he was actually a practicing corneal surgeon when I did my fellowship. Then a lot of people helped me during my course of professional, career, and I learned DSEC. I learned lamellar keratoplasty from Dr. Samar Basak and Audrey Rostov from US, and all my these three are my senior co-fellows of cornea, which I always owe, because when you enter into a fellowship, you don't know what to do, what to eat, where to go, and what to do, how to deal with patients. So these are the best people. So your mentee could be just your co-fellow, who is a little senior to you, a 6 months or a 1 year senior to you, who could always guide you through the institution. And also at a very personal and a professional level, I always owe it to Dr. Mohita for asking me to join WAS, to coming out of my cocoon, as I said, and telling me, and believing in me, and giving me the second annual conference of WAS, which was a very big event. That was the first conference that I did, any conference that I did. And I was not very sure of my capabilities, and we had passed through a very troubled time, me, myself. And this is when she believed in me in spite of all the odds going against the conference. And then it was one of the most successful conferences of the WAS till date. And and it is not that the mentoring ended here. The mentoring actually started from there, and it is still continuing on personal and professional level. And I owe it to my mentors, and I feel a mentor-mentee program can definitely make a difference, and it will always and definitely take you forwards all the time. Thank you.